Hi, I'm here today with Sean Reilly from Imaging Technology News at AHRA 2012. Thanks for stopping by the booth. We were talking earlier a little bit about some of the discussions that are happening here specific to healthcare reform and the Affordable Care Act, and what does this mean for radiology. One of the things that really stuck out in our conversation that we had was about the implications on workflow in the radiology department and potentially purchasing decisions. Can you talk a little bit about what you've heard or where you think the discussion might be going?
You know, I think everyone's looking for the answer as to what is going to happen to healthcare in the coming years and what's the show going to look like 5 years from now. And if there's a common thread that runs through everything I've discussed so far at the show, it's really workflow. I think you have 30 million people entering the system. You know, the question of, there's a lot of questions around that. How are we going to support that kind of volume coming through our system? Are there enough doctors? I read somewhere that we need 60,000 doctors by 2015 or something.
Right.
And then beyond that, you know, are we going to have the dollars if reimbursements continue to decline to treat all these people? And you know, if we're going to need more technology in the practices, how are we going to afford the technology? And I'm hearing some concerns about, you know, America once was a leading country in terms of high-tech technology, and I think there's more of a trend now that is driving technology to be more mainstream, more meat and potatoes, I hate to say that, to treat greater amount of patients going through. And then a big component of it also is workflow. We've got to get these patients through faster because there's going to be more of them. I think the system is already fairly strained. And when you have a strained system already and you're going to put more patients through it, the vendors, all the people exhibiting here, are going to have to come up with solutions, offer solutions to help.
Right. So lots of business intelligence on how do I, you know, get patients through my rad, you know, department faster. What is our report turnaround time? You know, all of that, and then also likely some technology, you know, standards, efficiencies,
outcomes, tracking outcomes. You know, having good, you know. Patients have to have good experiences as part of this too.
Sure.
So all this strain, all these questions, and then the patients have to leave with a happy feeling at the end of it also. Right.
Well, it sounds like this is a good show to be at because there's certainly a lot of technology for people to consider. There's a lot of best practices and sharing. So I think it's probably a great time for a RAD administrator at the show. Would you agree?
Well, I would say it's not boring.
Okay. Well, thank you. We'll let you get on and see more of the show.
Good. Thank you very much.